Dr. John Homans was among the original founders of the Society for Vascular Surgery, one of the early giants in our field. Dr. Homans popularized the ligation of the saphenofemoral junction for treatment of varicose veins. He also advocated ligation of the superficial femoral vein to stop migrating clots causing pulmonary emboli. In fact, he reported the first instance of a DVT, which occurred in 1954 on a physician who was a passenger on a flight. We established the Homans Lecture in his honor in the 4th annual meeting and has been a very popular event ever since then. Today, we continue the tradition by inquiring and looking a tradition of inquiry and forward thinking with a presentation titled "From Texas on the Tigris to Baghdad on the Bayou." Our invited speaker is Dr. Hazim Safi. Hazim is a professor and chairman of the McGovern Medical School at the University of Texas Health Science Center at Houston, UT Health. His primary interest is thoracoabdominal aneurysm and complex aortic surgery, and he has developed many surgical protocols. On a personal note, Dr. Safi is one of the most impressive technical surgeons I have ever met and one of the most warm human beings I've ever had the joy to encounter. One of the comments I had made yesterday was about how surgeons have grown throughout time. My father trained with Dr. DeBakey in 1960, and as one of the many stories that I remembered is we got to see him 1 hour a week on Sunday from 2 to 3, and we could meet with him as long as he never crossed the yellow line, because in that era, if you crossed the yellow line, you either got fired or had to repeat the rotation. I've known Dr. Safi for many years, and I've not only respected him, but honored his complacent and wonderful personality. He's grown up through that incredibly challenging system that I knew as a 6-year-old, and I wanted him to speak to us on the many trials and tribulations of being a resident and attending in the Houston system. So without further ado, I present Dr. Hazim Safi, one of the nicest people I've ever met. Thank you.
What a introduction, either for the fall or I wish my mom was here because she never thought much about me. I drove her nuts. Well, you know, I asked my friend Clem, when are we going to talk? He says, up to you. And I'm known to abhor authority, including my parents and my schools in Baghdad and here. And so I had to find something, so I saw Tigris from the Texas on the Tigris, which is our soldier named Baghdad, and when I came to Houston, they called Baghdad on the Bayou, which is a Houston. Both of them are fairly modern city. Baghdad was established by a king. It was a small town, even mentioned during Hammurabi time, but a king decided to build a new or expand the city in 760 to 740. He built the west section, and then his son built the east section, because he said, if the east section rise against me, I use the west section against her, and vice versa. And Houston is two entrepreneur Allen brothers, where they said Houston is on the beach. We are 50-mile inside land. It has a river, but it was really a buffalo, a creek. And it has a beautiful weather. It has mosquito, yellow fever. They were land speculator. One of them died of yellow fever, the other fled, but the wife of that who fled died, stayed in Houston, and by the time she died in 1896, she was the richest woman in Texas because she owned half of it, half of Houston. The story is Baldwin, her name Charlotte, and Sam Houston want to name it Charlottesville. She told him, no, you are famous, we named it Houston. And that's the name. And typical politician, he said, if you name it after me, I need half of it for me and the other half for you. It's really a great story to read. Well, in order not to take myself seriously, look how we are. I mean, all of us. So where a dust particle of the global, whatever that, the Big Bang 13.6 billion years ago. So I don't take myself seriously. Really, what you talk about, John Homans, it's amazing this family, which is started in the mid-18th century, where the father came from Kent, and he was a captain in the Navy, and he joined the Revolution, and his descendant participated in American Revolution, Civil War, World War I, World War II, and established. And John Homans, to me, is very important. When I was growing in Baghdad, and we have a very good library, and I was intrigued with Homan, how he described the test. I don't think anyone used the Homan test. What I'm going to talk, it's, you know, our brain play trick on us. According to neuroscientists, what we see, it's really illusion, they said. And also our memory is not really perfect. I mean, it's the brain play game. Unless you have picture for every year you are in, it's not, so it's, I think this word describe it. It's just like our memory when in the medieval time they write on the parchment, because the parchment was very expensive, they erase it and write on top of it. So this is our memory. And a famous philosopher, I don't want to mention his name because it might upset some of you, he said, history repeats itself first as a tragedy, because when I'm going to talk about the 120 days I spent without going home, and second as a farce, what I'm going to talk to you about it. You know the human migration, so if I'm going to talk about Iraq and Mesopotamia, I'm not bragging about anything. All Homo sapien came from East Africa and conquered the world. It's fascinated me is this is the Fertile Crescent, where a man settled there 50,000 years ago, and two migration to the left became European, to the right became the Chinese and Japanese, and what's left is us. And every empire has to conquer the Middle East. I don't know why the Mesopotamia. If you look at them, this is the Persian Empire, this is the Greek Empire. What amazed me about, that's contrary to me and team when he died in Babylon, Alexander the Great, and they asked him, who is going to take your place? While he was dying, he told them, the strongest. That's why his empire divided into many places. This is the Roman Empire, and also they came to in Mesopotamia for a bizarre reason. I don't know what's there. And this is the Arab, and the Islam, and then the Ottoman, and the colonial power, where they came in 1916, where they found oil in Iraq. And I have a story. Dr. Crawford asked me why we Southerner call the Arab, and I told him, Dr. Crawford, before World War I, there was a Bosphorus, Berlin, Bosphorus, Baghdad railroad, and the German wanted to dig for oil. And there was a Turkish Armenian, his name Gulbenkian, where he took as a commission 20% of the oil of Iraq. And that's all true. But when the English took over Iraq, they gave him just 5%. So he got 5% of the Iraqi oil from 1920 to 1972. You can see his museum in Lisbon. We call him Mr. 5%. He was a very cheap man, but very rich. Anyway, that's all true. And I told him, you know, when John Philby, the father of the greatest communist spy, Kim Philby, was the advisor of King Saud, and he found oil in Saudi Arabia, and he told British Petroleum, if you give me £1 million, I'll give you a secret about Saudi Arabia. And they told him, to the hell, there is no secret in Saudi Arabia. But Standard of Ohio gave him, I think, $2 million. And they found oil in Saudi Arabia, and that's all true. And then I think I read it somewhere, and I started fibbing to Dr. Crawford. I told him, you know, you in the South are very strong, so they send people who can tolerate heat. And they went to Saudi Arabia and looked at the Arabs, and they divide them into Arab, B-Rab, and C-Rab. And he believed me. So he told me, what are you? I am between B and C. And for some unknown reason, the American entered into Mesopotamia. So everybody came to Mesopotamia. I don't know, is this our collective memory? 50,000 years ago, we have to go to Mesopotamia. I don't understand it. You know, the most beautiful story ever told is from Sumer, which is Gilgamesh, which is a king who tried to live forever, but he discovered he can't, and the best thing will stay is work and teamwork. And God sent him, and Keto tried to kill him, and he was a beast man, and they gave him 7 pitchers of beer, and they brought him to Uruk. The Sumerian invented, you know, according to a book written, the Ark Before Noah by Finkel, he said, before the Sumerian there was prehistory. After the Sumerian was history, because they invented writing and the wheel. And also they talked about brewing beer. And they have a goddess called Ninkasi, the goddess of beer. It's amazing, it's how they describe drinking beer. It's like the onrush of Tigris and Euphrates. And it's really described the way you drink. And this is from Mirabah, Alberto Galliano. The first tavern, the first bar, was 600 BC in Babylon by a woman. And they have, you know, the beer distribution, payment, and also the debt. Hammurabi was very good with the people in debt, because every 4 years he will forgive them, and to the hell with the bankers. This is me at the age of 11. This man affected my life indirectly. My dad is coming from what consider a landed gentry, because his father has land, but he married up to my mom. My mom has a bigger land, and he worked for her. But he became left-wing. My mom stayed culturally and politically to her class. And my dad, between this, which was he was a principal of school, he was, and I was 11 months, and I never saw him till I was 6. And he, between that 47 till 74, he spent about 20% of that period, as he called it, guest of Iraqi governments. I mean, he was tortured, and he has a skull fracture. Between 74, I still remember in 1970, we were surrounded by 6 Mercedes with their machine gun, and walked into my dad. And my dad was, he's really in love with my mom. He has another philosopher, he loved him, and his psychiatrist told me, don't ever tell him whether he loved my mom more or the other guy. So I never asked him. And he was drinking his tea with my mom, and I was sitting there coming from residency, in Iraq residency. You spend just 12 hours home per week. And they told him, well, the president of Iraq then, before Saddam, they want you to be a cabinet minister. And he looked at them and told them, I don't shake hands with fascists. And he spent 4 years there, including putting him in the front of firing squad, but somehow he survived. So statistically, he should be dead. I personally, I love this picture because my dad could have died in 47, and this is the only connection between me and him. And he had a great impact on me. I thought he was 7-foot tall man, but he was 5'5". And he's not scared of death except from my mom. And I see the man is not afraid of his wife, is not a man. This is him where we did his hernia. Just remember, when people give you history for the young folks, be careful. My dad probably smoked at the age of 5. And when they asked him, did you stop smoking? He said, yeah, 10 years ago. Well, I told him, Papa, you were smoking in front of me. For him, stop smoking when my mom forbid him to smoke in the house. That's him. He liked a good scotch, and he is a dear friend of Ramon Burger. I think they have some kind of, they call themselves comrade, and they, over a glass of a grappa, they told all their history, because they both of them work in a clandestine operation. My medical school, established by Sir Harry Sanderson, who was one of the doctors who entered Baghdad in 1917, and he decided to come back and build my medical school. Here is the anatomy lab and physiology, and this is the modern building, and we are on the Tigris River. And as you know, 19, 20, 30, 20, 25-year-old boys and girls would go in the Tigris River after class, and we still have, at that time, we have a nude colony, but this is a top secret. We don't talk about it. This is the medical city, which is they build it like typical American, because the American architect built it. This is the Tigris River. One of those who affected my philosophy in my life is really Bertrand Russell, who was a great philosopher. His grandfather was a prime minister during Victorian time, and he went to Cambridge, a great mathematician. And I read his biography and affect my thinking as a secular man. This is my mentor, Yusuf. That's why I named my son Joseph. He is a heavyweight lifter, and when he came to the United States, he was the champion of YMCA wrestling, and he thinks Dr. DeBakey was a god, and he's the guy who introduced me to Dr. DeBakey. For those who think that I didn't do arteriogram, I did it before most of you were born, because this is in 1973, I was doing arteriogram. This is Dr. Cooley and my mentor when he was here in the 50s, where they were the first to write about shunting the carotid, and Cooley sent it to me. And this is Cooley later on. This is important for me because this is 4 months before Dr. DeBakey passed away. But if you look at the two noses, I wrote his obituary. I think it's his era. It should be called DeBakey era. He's a brilliant man, tough to work for, but a great guy. I met him in Baghdad in 1974 and told me I was the boy, so I took him with my dad's car, Volvo, red Volvo, around the and in the airport he told me, I'll get you in Houston. I never get anything. And I cut my tickets to go to London to get my FRCS. I received a letter addressed Hazim Safi, Baghdad, India, December 74. So I'm very grateful to the, I didn't say it while he was still alive because I was afraid of Dr. DeBakey until he died. And I'm very grateful to the Postal Office of India, otherwise I would not have been here. So I came to Houston. They offered me a fellowship and instructor in surgery. I told them, can I do board in surgery? They said, no. I told them, I don't want it because my mom will think I just was drinking and chasing something. So I went back to England, finished my primary exam. They gave me a job. So I arrived to this country, to Houston, in September 10th, 1977, and I never left to Houston or the United States. This is my home, and I think this is where I'm going to have my ashes there. This is the medical center when I arrived in 1977, and Dr. Crawford has an important impact on my life and also my career. I worked with him as a fourth-year resident, and it was brutal. I have two friends here, Bill Russell and Brushbab, and it was a commando operation there. We work 36 hours and 12 hours off, and But it was good. And Dr. Crawford, when he celebrated his 500 cases of thoracoabdominal aortic aneurysm, and this is my friend Kerry Stowe, and I wrote his obituary. I personally, Dr. Crawford, till today, I have never seen a surgeon like his eye-hand coordination. It's impressive the way he makes things look simple and easy, sizing the aorta, sizing the graft. I haven't seen one like him. As we say, that Sir Isaac Newton, we stand on the shoulder of a really true giant. I'm here because I met Dr. DeBakey, and my mentor introduced me to him, and met Dr. Crawford, and who offered me a job in 1983. And because I was looking for another job, and he said, no, you come and work with me. You know, thoracoabdominal aortic aneurysm, since inception, is plagued with paraplegia. This is from a Babylon instruction for the hunter. If you spear the lioness in the spinal cord, you cause paraplegia, and it will eat you. The first Rutherford vascular textbook, look at how many pages on thoracoabdominal aortic aneurysm. It's 3 pages, 2 of them are pictures. Actually, the thoracoabdominal aortic aneurysm is about brain, spinal cord, heart, and lung, and GI tract. I'd like to give you the concept. You know, in the 50s, there was just started to have intensive care. Dr. DeBakey, Crawford, and Cooley did their operation. And the first intensive care were in Copenhagen. And of course, the first modern was in Mary Hitchcock Memorial Hospital. And of course, Johns Hopkins has a first neurosurgical in 28, and Massachusetts has a burn unit. So there's a lot of controversy who did the first. DeBakey and Cooley did the first thoracoabdominal aortic aneurysm, as shown in this picture. Charles Robb, the first to coin thoracoabdominal aortic aneurysm, the word, and he did one. But we accredited the first one to extend 4 thoracoabdominal aortic aneurysm, Samuel Etheridge, but his other interest is also poetry. If you like poetry, read his poetry. It's beautiful. DeBakey did the true thoracoabdominal aortic aneurysm using homograph, and subsequently he used a dacron graft in the descending to infrarenal, and sequentially bypasses the important arteries. As I told you, I used this for a patient who has a ruptured thoracoabdominal aortic aneurysm with stage 4 cancer, and they sent him to me, so I did his operation, and the patient lived a year, died from his cancer, not from rupture. So there is a place for it. We go to the 60s. It's amazing. A friend of my dad who's he loved Mustang, but my dad always teased him, tell him, will you pronounce Mustang? And he has a lisp in his tongue, which he called Mustang. So I don't know why he got... and DeBakey had his method of treatment in 1965. Simultaneously, you know the Bill Bottom, have you seen that? Or some of you are not born. And Conley did the distal aortic perfusion. And you have Alexis Carrel, the suturing technique. Oscar Creed described the inclusion technique. And Crawford in 1965 did the first case of thoracoabdominal aortic aneurysm depending on these principles: reattachment intercostal artery, inclusion technique, and the small artery into big artery. And his helper was Dr. Victor Bernhard. I used to have that operative report. It's August the 2nd, but one of the residents stole it from me. It took him 10 years. If I know him, I would not let him take the board. From 65 till 74 to get just 22 cases, and 2 problems were there: renal failure and paraplegia. That's his paper. We come to the 80s where it's amazing. The Sony disc man, and I told you about the 500 cases. It's in January of 1984. Joseph Cunningham challenged the clamp and go by using somatosensory evoked potential. We tried it with Dr. Crawford. We didn't discover anything, but we discovered there is a delayed paraplegia. And the classification almost get fired for that because you can't remember it really. It's A prime, A double prime. But a friend of mine, Evan Cohen, who's in Huntsville, Alabama, with Dr. Crawford, they have the classification, which is 1, 2, 3, 4. We come to the 90s, and the 90s, we survived the end of time. That's 18 years since the end of time. And everybody started using profound hypothermia. Of course, the thoracoabdominal surgeon, the cardiac surgeon, tried to use it. But it came to me, I was reading about the impact of cold. This woman, Angreen, was a maid in 1650 and worked for a lord. Somehow she has intimate relationship with the grandson of the lord, and she didn't know she was pregnant, and then she miscarried. And of course, the Puritan at that time, they said, she killed the baby killer, so they hang her. In cold December 14th, 1650, for half an hour. And her friends were pulling on her feet because they wanted to die quickly. And the other guy hit her with the butt of a musket in her chest. And they put her in a coffin. They gave her to Willis of Willis Circle with the anatomist, because they're Christian, you cannot dissect Christian, but if you are a criminal, you can dissect them. So when they opened the coffin, she was still alive. So they pour whiskey in her mouth. She woke up. After 3 days of nursing her, she was eating, sitting. Guess what the Puritan want to do? Want to hang her again. What a great guys. So Willis and Petty told them that's a divine intervention, and she lived normal life, married, and has 5, 6 children. I was impressed with the stoic nature of the English people. That's tough. So that I think the reason she survived is 2 things: that the cold weather in Oxford in 1650, and the one who hit her on her chest, I think he disrupted the fibrillation. That's what the impression. I don't like profound hypothermia through the left chest. I have a patient came from far away with this, and we couldn't put a clamp, and we used heart-lung machine, not hanging. And we started 8 o'clock, but 8 at night, it was misery. All the blood pressures, PA pressure is in the 40, and the anesthesiologist says, if I have a clamp the pulmonary artery, clamp the pulmonary artery, did luminectomy, this is the lungs, and the patient recovered. That's why we don't use it. You know, if you look at the mortality, it is high. And if you look at the paraplegia rates, it doesn't help. This is our recent. We use it sporadically when you are dissecting and your finger goes inside the aorta. You have a warm feeling in your fingers, but cold feeling in between your legs. It's still the mortality rate high. I think Richard Cambier, my friend, and Ramon Berger decided to use regional perfusion, when they put a catheter in the spinal cord from both sides. But the problem with this, the cooling is not uniform, but the high CSF pressure is high, which will cause paralysis either in the upper limb, and that's why we didn't use it. I think this is a paper I was frustrated in 1992 where paraplegia is high, so I read it. My friend, I hope Larry Ollier is here, and he has this paper. When I look at the face of this animal, it looks smiling. I don't know why with this kind of things. I want to ask him, what did he give him? We use the CSF drainage also, but we use it just to take 100 cc intraoperatively. So at the end, Dr. Lars Vincent, my dear friend, and looked at the extent of the aneurysm, and the clamp of go is an important factor. Aortic clamp time, rupture, age above 65, proximal thoracic aortic aneurysm, and renal dysfunction were risk factors for paraplegia. And we decided to study that. We decided to use distal aortic perfusion, CSF drainage, moderate passive hypothermia. That will give us an ample time to do the operation. And this is based on work of Miyamoto in 60, Dr. Cooley and Blaisdell in 62, and Larry Ollier. And this is a letter from Denton Cooley to Dr. Estrella telling him how he did the CSF drainage catheter. And the distal aortic perfusion is really also nothing new. So we combined these two. We did it in animal models. I didn't put the animal, so I don't want him showing him and we found the CSF drainage distal aortic perfusion is the best result. And we use the combined methods and extent 5, which is from 6th intercostal to above the renal. And this is our classification. It has the upper extent of extent 3, the lower extent of extent 1. And now we come to the widespread of the web, which I'm still, you have to call me or if you want to talk to me. I'm a little bit on the paranoid side. And the proton, the hadron collider showed how we get a mass, Higgs particle or boson particle. They showed he got instantly a Nobel Prize. He thought about it in the 60s, an English mathematician. Joseph Caselli looked at the randomized trial for CSF drainage, proved that CSF drainage is good to prevent paraplegia. We survive the Mayan calendar, we're the end of time. And basically we are in the basic, and this is the neurologic risk factor. In the past, extent 1 and 2 are high risk for paraplegia, extent 3 and 4 low risk, and 5, we didn't have it then. And this is the era of clamp and go, the longer you put the clamp. This really irked me. This, I got it from a textbook about if you keep the the clamp above 60 minutes or 90 minutes, it's 100% the patient is going to develop paraplegia. That's not true, because I looked at my experience in patients who are where we put the clamp for many reasons, either the heart is unstable or we kept it or bleeding for 120 minutes, and the risk of paraplegia is 0.5. 50%, that's what I mean. So this is, I think, made up slide. So question everything in science for the young folks. Don't take what I say as Max Planck said, physics, when I don't say science, progress one funeral at a time. The neurological deficit is really devastating. People die quickly, and this is what CSF drainage, this is the beam bag we put the patients, and we use the biomedicus pump. We use sequential clamping. We do proximal excision. We lifted the esophagus, the aorta from the esophagus to prevent esophageal fistula. And then we go sequentially after proximal, reattachment of intercostal arteries, pulsatile flow to the intercostal arteries, and this tepid blood to the celiac and superior mesenteric artery, and cold crystalloid with a little bit of potassium to the kidney, keeping the temperature less than 20 degrees Celsius. By the way, the visceral perfusion was done by Korompai, who fled from Hungary during the Hungarian Revolution, and Dr. Debicki accepted him, and he wrote about it. So nothing new. We reattached the viscera. Then after the distal anastomosis, this is a patient with extent 2. Due to dissection, this is the artist's rendition of what we did to this patient. And this is showing you a patient with thoracoabdominal Marfan ascending an arch. We replaced with elephant trunk. I'll show you part of it. And we replaced the thoracoabdominal, the iliac bifurcation. Of course, the patient walked home. Otherwise, I would not show it to you. But she developed renal failure and recover after 4 weeks. We found that these patients would develop renal failure within 4 weeks, 90% will come out. This is the CSF drainage catheter, the minimally invasive incision. And we clamp because we had an elephant trunk. We don't put a proximal clamp. And this is the bloodless field. You will see it. Now my associate, Dr. Tony Estrera, like to pace the heart and then make less bleeding. This is the stack graph, and the rest you saw it in for sake of time. Tony is really an outstanding surgeon, and I hope he will take my place. He update our result. You know, mostly it affect men. That's why I tell Deborah, my wife, we are prone to violence because of our hormone. We die prematurely. I don't know what's the infatuation with the male sex. The overall incidence is 4%. It used to be in the cramp era was about 16%. And currently, extent 2 is still a risk factor for paraplegia. Renal dysfunction is a risk factor. Adjunct and clamp time. Adjunct was a beneficial, blunted the effect of clamp time. And this is the modern era where you have 2 and non-2. So the extent 2 became like extent 4 in the era of close clamp and go. And this is the graph. We flatten it. And these are the conclusions. The adjunct has a great impact. And shows you, still we have the acute dissection, extent 2, a risk factor for paraplegia. Just one slide about descending thoracic aortic, and we divided to upper half, lower half, entire descending thoracic aorta, and look at the durability. For those who are putting the stent, this is the durability of our. With that, I think once they develop infection, respiratory failure, neurological deficit, heart failure, renal failure, might as well call the undertaker. With that, I thank you all.